Yep, you're all recording.
Okay, awesome. Thank you so much, Jenna. Okay, folks, we're gonna dive right in. I am Melissa O'Connor. I'm one of the trauma therapists over in the CVSS program in Family Services. Today, we're going to be looking at children as witnesses and how they are being impacted impacted by domestic violence. And as we're still working from home, or as I am in this moment, I just want to be mindful that I do have my coworker, my cat, here with me, and sometimes she likes to go on top of the laptop and mute me. So if you do hear other noises that are critters, that is just my cat as we're recording this. So I just wanted to be mindful of that. So a little background on me. Again, I am one of the trauma therapists at Family Services in the CVSS program. I've been doing work with domestic violence and sexual assault survivors for about 13 years. In addition to being a mental health counselor, I'm also a trained forensic interviewer. So then I am doing interviews for child abuse cases, witnesses to violence, other crimes and things like that through a multidisciplinary team in Connecticut. So as we're going, let's see, I'm going to minimize my screen that shows who's in the chat and all those things. So I'm not going to be able to see the comments being made or questions. So I'm going to just park those for the end just so we can get through everything. And just for everyone to be mindful, this training is about an hour and a half long. So if you do have to get off around 1 o'clock or in that hour range, feel free to do so, and always reference back to the Teams chat where you can find this training. So I just like to be mindful for everyone, because I know that there might be people from the community watching or accessing this training, and also those who are within Family Services. And as we're going over the topic that we're talking about today, there can be sensitive matters, or there could also be things that might be triggering to some. So just keep in mind to take care of yourself while we're going through this training. If you need to take a moment to doodle or to debrief, just to step away, that is totally fine. And I offer this when I'm in person or through the computer as we're doing it right now. So just be mindful of yourself. And if you're feeling a certain way, that's totally fine. I encourage folks to reach out to their supervisors, or if you need to reach out or touch base, you know, my door is always open, or my email is always open as we're working from home and transitioning back into the office. Also, those for the community to be mindful of our domestic violence hotlines. That is available if there is something that you want to follow up on as well. So what are we going to be learning about today? So we're going to be defining and reviewing statistics on children affected by domestic violence. We're going to discuss how they're exposed to domestic violence, how they're impacted, messages that children receive after witnessing DV, and how to support these children and their non-offending caregivers. There's also other little tidbits thrown in the mix that is related to this topic today. So definition of children and domestic violence. So this is children being exposed to domestic violence as either seeing, hearing, being told about, seeing the aftermath of abuse used against a caregiver. So there's a wide variety of how children are exposed. So it's not necessarily just seeing it firsthand. And it's important to be mindful that about 15.5 million children live in households where domestic violence has occurred within the past year. This statistic is from 2006. Most statistics have not been updated, that at least I have tried to find in the more recent years. Other studies have shown in the 90s that between 3.3 million to about 10 million children live in households where domestic violence are being exposed each year. So this is the most up-to-date statistic. I wish there was more up-to-date statistics, at least I have not found it, but this is a general consensus. So children that are being exposed to domestic violence are at more increased risk of physical, sexual, or emotional abuse or neglect. And 70% of children exposed to domestic violence are also victims of child maltreatment. We'll get more into that and how that goes. And I always like to point out that it's really important to understand that there might be several types of violence present in the same family unit or whatever the unit might be where domestic violence is within the home. And it's also important to know that children who, I mean, at least as a forensic interviewer, when we are interviewing a child that may be where there's domestic violence or physical abuse allegations going on, we always screen for sexual abuse, but it's more important for us, or more push, I suppose you would say, when there is domestic violence or physical abuse, because it's shown that that child is more at increased risk of being sexually abused in their home as well, or just in general. So how are children exposed to domestic violence? There's a wide spectrum of how they can be exposed. So first off, they might feel tension building in the home prior to the assault. So you might hear adults saying, you know, when I'm around them, my abuser, I feel like as if I'm walking on eggshells. So this is something to be mindful of, that it's not just the adults within the home or the primary victim of the situation that is feeling that tension. The children can also feel that tension that's building in the home. And, you know, noticing shifts or noticing, okay, maybe the abuser this day seems to be okay. They walk in through the door when they come home and they seem to be in a better mood versus maybe they come in and they slam the door or something. Or, you know, when you're living with someone who you kind of know, you know, their mood and things like that. So feeling that tension building prior to an assault. They might be hearing threats of physical harm, may that be, you know, from the other room, or hearing, you know, if you do this, then I'm going to, you know, use physical action against you. And I think it's very important to also understand that even though there might be hearing things of the abuser threatening the primary victim with physical harm, it's also important to note this also goes into the abuser threatening suicide. And that is a huge tactic that abusers use to gain power and control in the situation, where if a victim is wanting to leave, the abuser might threaten suicide to themselves as a tactic to keep the victim. So that's also important to know, that children might be hearing that as well. And that is just as harmful as just hearing the threats of like, well, I'm going to hit you or use a weapon against you. So the escalation of hearing or seeing assault on their caregiver. So one, the child might be in a different room, or maybe they were sleeping and they hear something in the other room, and then they can hear crashing or they can hear thuds or whatever that is. That is still alarming and threatens a child's sense of security, just as if they're physically like in the same room or seeing the assault on their caregiver. Also, being denied care because a caregiver is injured or depressed is a form of how a child is exposed. So maybe they're not even there when escalation occurs, but maybe someone is injured, so they're not able to go cook something, or maybe laundry is not being done, or, you know, just all those things, or even like, you know, the physical household items or basic needs, but also emotional needs might not be met because of the state of the caregiver is in, which then impacts the child. Being forced to watch or participate against their caregiver is a tactic that might be used, just to enforce being scared, diminish the relationship between the child and the person who's being victimized. That is a huge tactic that people might use sometimes, or using children as pawns in general when it comes to domestic violence is something I often see. Seeing the aftermath of a violent incident. Again, maybe the child is not physically there, but maybe they come home or they come from outside after an event, and maybe they see something broken. For example, I had a client who there was DV between one of his biological parents and step parent, and, you know, came downstairs or from outside or what have you, and sees that there was picture frames that were broken. And though the child was not there, he was not aware of what the incident was, they kind of connected one and two together and understood that this wasn't because, you know, there was an accident. It was because of most likely an event, and helped expecting their step parent cleaning these things up. And that was something that impacted them and just angered them walking into such thing. Again, having their relationship with their non-violent caregiver undermined. So maybe there might be things where the offender is like, oh, well, you don't have to listen to your other parent. You know, they're so stupid. You know, they're, you know, always trying to make rules and like, you know, love me, kind of like, you know, just come to me when you need something. You know, you don't have to respect them, or the rules don't apply, things like that, just undermining the non-offending caregivers, you know, parenting style or their skills, or even just forming that relationship as, you know, a healthy relationship might be undermined. I had a client again where the offender would talk about the non-offending caregiver's past and diminishing them and saying, you know, how much of a, you know, they're promiscuous and all this other stuff, or look at all these other failed relationships. And this is something that they're saying to someone who's, you know, the offender is saying this to someone who's in elementary school. So, you know, viewing the non-offending caregiver like as if with no respect. Being taken hostage to force the victim to return home is something that can happen. And I want to further reinforce this is not like a taken situation where it's like, you know, they're being forced and they're blindfolded and they're caged or, you know, handcuffed or something like that. This is something where, you know, maybe the victim leaves the situation and it just was not safe for them, or they did not have the ability to take their children with them. So the offender might use the child as a pawn, I mean, like, oh, you know, so-and-so, your parent left us. I guess they just, you know, they might not care about us, or, you know, I'm really worried about them because they've been gone for so long. And, you know, and then having this child reach out to the parent, and, you know, reasonably so, if a parent has left and that child misses them and wants them home, they're going to reinforce that, and that could eventually bring the victim home to an unsafe situation. Or also, this is always a fun one, when abusers say, you know, if you leave, I'm going to get custody of the children and there's nothing you can do about it, which is not true. Parents have rights to their children. You know, it's something that's going to have to be figured out, but they might use threats that, you know, they're going to take the children away from them, that the non-offending caregiver is never going to see them again, that they're going to make it out that the non-offending caregiver is crazy and not fit to be a parent, or, you know, make allegations that they're using drugs, all those type of things, which is further reinforce the victim to stay in that situation, and which in turn the child has to stay in that situation too. The offender might also enlist the child to act violently towards the non-offending caregiver. So, and you know, not just like participating, but there might also be, you know, allowing them to use verbal abuse or throwing things or using, you know, physical abuse against the non-offending caregiver. And on the full spectrum of things, that the child might experience loss of a caregiver due to murder and or suicide. So these are just some of the ways that children might be exposed to domestic violence. So the general impacts, we're going to go into many impacts on children, but it's important to know that between 80 and 90% of children living in homes where interpersonal violence is present know about the abuse. And I highlight this and bold this on the PowerPoint because this is very important information to know, especially when we are working with folks in the community that maybe they're, you know, on the fence if they're going to stay or they're going to leave. And a big factor is their children, because they don't want to leave the home. They don't want to disrupt the child's life. They want to try to have things consistent. Or I often hear, you know, well, you know, the kids don't know. The kids don't know that this is happening. And it's very important to educate others that, again, this is something where between 80 and 90% of children living in that home know it's present. And as we just talked, you know, it might be something where maybe they don't see something or hear something, but there's still the feelings going on, that feeling of escalation, seeing a parent so many times. If parents are, you know, maybe crying for a minute and then them, you bring them out, they compose themselves, they look okay. That child is, how many times have you had, like, have you been crying? I've had kids say that so often to their parent in front of me, and if that's in a DV situation or not in a DV situation, the child can see when a parent is upset. Even if they don't fully know why, they're still interpreting that in some way. So it's very important to know that kids can hear. Just because they were asleep or you thought they were asleep doesn't necessarily mean that they were. How many times have you been upstairs maybe or in the other room and you hear that, your sibling is getting in trouble and you're just like, oh, I gotta listen by the door. These are similar situations where a child might be hearing things that might be going on in another room. There's so many different other factors. It's also important to know for general impacts that domestic violence threatens a child's need for predictability, consistency, and attachment. And these are highlighted because these are huge to the development of children. When we're learning things or socially learning, educationally learning, like all these different factors, emotional learning, these all go together in terms of how we're gonna move forward and develop and how our relationships develop and all those different things. So these are huge factors that are being impacted by domestic violence, because sometimes one day it's okay that you spilled water on the carpet, and then the next day it is not okay that you spilled water on the carpet, and then there's a hole in the wall. And that's like, okay, well, this was okay, but now it's not. So what is that, causing anxiety and uncertainty? Also important to know, watching, hearing, or later learning about a caregiver being abused threatens children's sense of stability and security, because now they're wondering, okay, now I know about this happening, what's going to happen to me? I'm worried that my caregiver is going to get harmed, or now that they are injured, now I have to worry about cooking a meal or something like that. Or when they're at school, they're wondering if everyone's okay at home. All these different factors of things that at least children that I worked with, these are factors that they brought up to me. I'm sure that's consistent with many other children who go through this. Understanding that children aren't passive witnesses, but are active interpreters and observers of situations. So again, kids are not just like in a corner, even though they're like not talking, or we can't, sometimes we don't want kids to be heard or seen, but they're there. They're witnessing things. If you're in the same room as children and we're using like, oh, well, we have to go to the STORE or the, and spelling things out, like, the kids eventually understand and learn and interpret what's going on of certain situations. So, kids are smart. Children living with domestic violence are also at risk of increased emotional and behavioral problems. Understandable. And for children, change can be sudden or gradual. Change can be visible or from within, and change can be both positive and negative. So what does that mean? So change can be sudden or gradual. So maybe we're noticing things within a child. Maybe they're been in a domestic violence-based home for their entire life. So, it's just status quo. The abnormal situation is their normal. So we might not see anything different within that child until maybe they're getting older and going to different developmental stages in their life, where maybe things are coming out when they're older versus when they're younger, so exhibiting those emotional behavioral problems. Or perhaps it can be sudden out of nowhere, where maybe, their non-offending caregiver then gets into a relationship that's DV, and that's not something that they've known before. And then we're noticing that quick switch of different changes within that child. Changes can be visible or from within. So we have the visible. So we have the kid who's the class clown, the problematic, I'm using air quotes, the problematic child, the one who's rambunctious or, loud and whatever, the disruptive child. These are things that we can visibly see, where we're like, okay, what's going on with this child? Or it can be something more internal, where it's the quiet child, the more shy child, where their struggle with what's going on at home is showing up internally. And we're just like, oh, that kid, little Sally is just so well behaved, such a good kid. Meanwhile, internally they're screaming. So needing to check in on our kids too that are quiet, and the quote unquote well-behaved child, is important to check in on them too. Changes can be both positive and negative. So again, maybe we have a child who is disruptive in class, or getting in more trouble, or stealing things, or whatever those type of things could be happening, versus maybe we have a child who is into so many sports, after school activities, is always at a friend's house, is so well behaved and so quiet and just respectful. All these things are viewed as a positive thing, but they're trying to be such a perfectionist to try to counteract that abuse, which is not going to necessarily help in the end. But these are different things of general impacts on children. So factors that affect impact on children. So a child's age. So as a child is younger, when kids are young, they are so egocentric. So everything is about them. They interpret things as if, this is about me. This isn't about other people. For example, if children who come from divorced families, even if they're told multiple times, like, this is not your fault, they're still feeling as if that divorce is their fault in some way or fashion. Or if I just did the dishes, or if I did this, then you guys could stay together. And also knowing that younger children, they don't understand necessarily why the abuse is happening. So then that's going to cause a lot of whys, and not being able, and younger children are not necessarily able to regulate their emotions as well as maybe older children if they have that guidance early on. In terms of children in developmental stages, that can have impact just as age. So there might be different children at different developmental stages within the home. So one might be impacted more than maybe in a different range. But if there is domestic violence being present during a certain developmental stage, that stage might be affected, and that those milestones within that stage might not be fully developed. Severity, proximity, duration, and frequency. Just with sexual abuse, the more often it's happening, the more involved you are, the length of it, the frequent, if it's happening more often, if there is, verbal abuse can have a tremendous impact. But maybe if we're saying, threatening abuse versus, actually physically harming someone, there might be differences in reaction and impact to it. So the more often it's happening, the more impacted someone might be. The child's gender. So this is not saying that one gender or a specific gender does better than the other in terms of impact. It's just noting that maybe there's trends related to uniformed reactions to violence that is going on. So maybe if there is the non-offending caregiver identifies as female and has those stereotypical female characteristics, maybe the child is going to respond, who also identifies as a female, might have similar reactions as the non-offending caregiver. Versus someone who identifies as a male, their actions might be different. So it's neither here nor there. And I also would note that I have not seen studies done for children that identify as trans or non-binary. So that would be interesting to see if there is some type of role with that as well. Their role within the family. So maybe if a child is, an only child, their reaction to things might be different versus when there's multiple children. So there might be someone who identifies as the scapegoat or the caregiver, the referee, or the perfect child, like so many different roles within the family of how they are dealing with their guilt and grief over the interactions that are going on in their home. Personal characteristics of a child. So maybe one has more of a sense of humor, so they're trying to lighten things up, versus someone who might be more withdrawn or shy or introverted, versus extroverted. There's so many different characteristics that can impact a child's response to the violence. And also being factors is stability and responsive to systems that are interacted with the child. So if we're having someone who has someone in their life that is present, who's loving, who's caring, who's a good role model, that child may not be as affected by maybe someone who doesn't have that supportive caregiver in their life or figure or anything like that. So here's another nice, beautiful diagram. I wish we kind of had this in a Venn diagram situation, just showing different impacts of domestic violence on children. So we have from the womb to 1 year, so many different responses that might be happening from 2 to 4 to 5 to 12. This is not the end all be all. I would like to say that, especially for the fact, again, like I wish this was a Venn diagram situation, because I've seen children within the 2 to 4 range that are experiencing things that they're noting as the 5 to 12 range. So I've seen children who are 3 and 4 who are parentified and they're taking care of their younger siblings in some fashion, or not understanding, especially I did my clinical internship at the children's home, where it's like, what do you mean I can't hold my baby brother or sister? What do you mean I can't feed them? Like, that's what I do. Like, that's my job when I'm home. So what's going on here? So this is just a good visual representation. We're going to go more into the different impacts that might be showing like red flags of maybe abuse being done by a child. So we have all these different things, but it's always important to note from womb to 1 year, sometimes people have questions about, what do you mean? How is this child's not even born yet? So how are they being impacted? Well, I'm glad you asked, because I will get into that right now. So from the womb to 1 year, and how their children, or the fetus specifically, is being impacted. And this is obviously something that is impacting someone who is a child who has the ability to bear children as a woman. So when there is a victim who is able to get pregnant during their domestic violence, this increases their risk of violence during their pregnancy. So women are at great risk of experiencing interpersonal violence from their partner during pregnancy, and this is something that is often shocking to people. It's something I also screen for when I'm working with clients, especially if they are pregnant or have been pregnant with their abuser. I like to see, okay, when you got pregnant, did the violence increase? And oftentimes too, this is sometimes confusing for people, especially if the fetus is the offspring of the abuser. So why would the abuser start to, biologically, this doesn't necessarily always make sense. So oftentimes if someone becomes pregnant, they are tired, they are fatigued, their needs change as opposed to when they were not pregnant. So all this time that maybe might have been focused on the relationship and the abuser is now being shifted and put on, more attention. The victim is putting more attention on themselves because maybe they are having morning sickness, or maybe they do have to go to the doctor, or all these other things that they have to do to prepare for the progress of their pregnancy. So the abuser might see this as a threat and therefore might start to increase the violence. So that's something that could be noted. So women who are pregnant and in interpersonal violence relationships are more likely to miss 3 or more prenatal visits than non-abused women. And that is hugely important, because especially when, you have to be monitored, you have to make sure your sugar levels, there's so many different factors that go into pregnancy that should be monitored. Physical and emotional and psychological interpersonal violence can increase the risk of inadequate prenatal weight and additional adverse influence. So the main focus is on low birth weight and premature birth. Those are causing, and this is, in terms of just any pregnancy, if this is something that is occurring, that puts the newborn child at high risk because they're not fully developed. they are not necessarily, maybe they're not breathing enough, or their brain functioning isn't as high as it should be. All those different things that can then cause failure to thrive, and so many different other factors. Also to note that interpersonal loss could cause changes within the mother's stress response system. So if they're constantly stressed, or when we are stressed, especially when there's threats, then we are having a push of the hormone cortisol, which then in turn increases levels in the fetus. So everything, just as whatever mom is eating, that baby is also eating. What mom is experiencing in terms of hormones, the baby is being exposed to those hormones as well. So that is going to, change the functioning and the development of the fetus while in your utero. So the more often there is cortisol being pumped through us, not so good for mom, not so good for baby. Fun facts, I believe cortisol, if you have higher levels of cortisol, that doesn't help with weight loss and things like that. So fun facts on that. So impact on the child once they are born. So children born prematurely and with low birth weight are at increased risk of cognitive deficiencies, motor delays, including cerebral palsy. When they're older, might have academic difficulties, language delays, increased rates of attention problems. So when we have these kids who maybe have ADD, ADHD, behavioral difficulties, and psychological problems. And also to note, the excessive exposure of cortisol, also known as toxic stress, can increase changes in the fetal brain and impairment to the emotional regulation, or impulse control, increased risk of mental health problems, and chronic disease later on in life. So you're just like, my goodness, this fetus isn't even born yet, and it's already from the get like pushed back in terms of developmental milestones and all these other different factors. Of course, with the treatment and other things, these can all be improved. So just to be mindful of that, but these are all risk factors, which then in turn, cause a lot of issues, especially once they are born in a home with an abuser, especially. Okay, so impacts on domestic violence on children from a developmental perspective. There are many different developmental perspectives, but I went the route of Erik Erikson, who is widely known in the field of psychology and development. So Erikson has 8 stages of development, and it's widely used and universally accepted model explaining the developmental tasks involved in social and emotional development of children that continues into adulthood. So they have these different stages. We are only going to get into the adolescent section, just to not get into the young adulthood and all of those different things. And it's important to note exposure to domestic violence at any age can create delays in accomplishments of important developmental tasks, which then can delay and cause a lot of issues in terms of social and emotional development. So let's get right into it. Okay, so when it comes to children from 0 to 2 and then from 2 to 3.5 years old, there are the first 2 stages of Erikson's model. So in infancy, we're building trust versus mistrust. If we have trust, then we're going to build hope. If we have mistrust, then we're going to have withdrawal in children. So this could be shown maybe a child who's being attended to, their diapers being changed, they're being fed consistently on their schedule of the 2 to 3 hours, depending on where they are at. They're sleeping. Hopefully they're sleeping. For the love of God, let's hope the baby is sleeping so we can also, as parents, get sleep. But if they're not, or if maybe they're crying or reaching out to their caregiver and they're not receiving those things, then like the children who have failure to thrive, they're crying. Their needs are not being met, and then even when they are hungry or soil themselves or have some type of other need, maybe they're not crying out and getting, again, not being disclosing that, like, hey, hi, I need something to be met, because it hasn't been treated for other times it's cried, so why am I going to cry now? So those kind of things. Early childhood, we have autonomy versus shame and doubt. And so then maybe we have a child who is who's exploring, who's crawling, who's like into things. Those are good signs, even if it drives us crazy when we're just like, no, don't touch this, don't touch it, don't put that in your mouth. You know, these are good things that are showing that the child is exploring and trying to engage in their world. Versus shame and doubt, and maybe they have more compulsions and uncertainties. Again, maybe they're not having that consistency, stability, and that attachment is being impacted. So the general impact of this is maybe they have disorganized attachment patterns. So maybe one day they want to go to a parent and then the next day they don't, or, you know, just this inconsistency of like, who's going to take care of me? Because one day you were okay, now you're yelling and I don't know what to do. From a child's perspective, they are responsible for the trauma. They are responsible for the abuse because developmentally, they don't have the cognitive ability to try to figure that out. So they're going to have that internal perspective of blame. So signs and symptoms, if a child's being impacted by domestic violence, a long list here. So we have, again, uncertainty about reliability and predictability of others. So maybe they're not willing and uncertain and scared of other people, or uncertain about even their own caregivers. They might use aggressions against themselves or others because they don't necessarily have that emotional development or know how to respond. And if they're just filled with all of these emotions, they just don't know what to do with it. So from the 2 and 3.5 year age, you know, I've seen children who do have self-harm where they're pulling their hair out, they're bending their wrists, they're throwing themselves into things because, you know, they have all these feelings and emotions and trauma within them, and they just don't know how to get that out. Delayed startle reflex or strong startle reflex. So if we drop a book on the floor, there might be a kid who's just like, okay, whatever, bye, I'm gonna go play over here or do this, and I have no reaction to that book falling or a slamming door because that is my status quo of loud noises. Versus maybe there's a child who's, again, very hyper vigilant, scanning, just like, oh my God, like every little thing is startling them. Sleep disturbances, eating disturbances, speech problems, delays in toilet training or regression in toilet training. This is clearly toilet training age. So if there is a child who's having problems, not necessarily that they're being abused, do our best, just do our best. But these are things that could be impacted. Clinginess, depression, withdrawn or responsive, so many different, or even physical injuries, trouble relating to other children because maybe they don't interact with other kids, or not because their abusers not allowing the family to leave the home or go to parks and things like that. And ultimately could also lead to death. So the age range, so we've got initiative versus guilt, and then if we have initiative, we have purpose, we have guilt, we have inhibition. So if we have a kid who's like, okay, I'm gonna go on the playground, I'm gonna go play with that kid Caleb in the sand tray, I'm gonna go build blocks with little Riley over here, versus who's like another kid who's like, I'm not really certain about this, I'm gonna just stay over here by myself instead of going and playing with whoever, the little Primrose over there, whatever we're naming kids these days. So that kind of understanding from the 3.5 to 5 year age. So general impacts is that they're having insecurities, and again, unpredictable responses to stimuli because there's not that predictability, there's not that stability within their caregivers, within their home. So that's going to be thrown. So from the child's perspective, they might be feeling helpless and they might be feeling passive because learned helplessness is being grown. And it's like, okay, well, what am I going to do here? Like, I can't protect myself, I can't protect others, like where I'm just nervous, uncertainties, all of that. They might feel threatened by separation from parents or caregivers, which again, we're getting into that range, preschool, kindergarten. There are kids, of course, the first time or the second or third, the first week of going to school, there's going to be some kids might have difficulty with that transition because it's something new, and just that parent who is consistent, you know, reminded them, you know, we're only going to be here for this long. Either kids don't have a sense of time at this age. You know, I'm going to come back. We're going to go home after this. Like, remember yesterday we did this too. You know, if they have a consistent and predictable caregiver, they might have an easier time of that transition. Or again, those kids who have more initiative and purpose, they're like, ooh, shiny thing over there in the corner. Let me go make friends. Also, from a child's perspective, they might have difficulty managing intense physical and emotional reactions. Again, not necessarily knowing what to do with their emotions. If they get, you know, hurt or something like that, like, what am I going to do here? Am I getting taken care of? And they might become upset hearing cries of distress from their parent or caregiver, again, like not knowing what's going on and maybe feeling like they are responsible to help to comfort their non-offending caregiver, which of course is not the responsibility of a child or a teen. May I've also put that in there as well. So signs and symptoms of being impacted by DV, again, hyperactive, argumentative, having hypervigilance, having a hard time with emotional regulation. Important thing, which I also see within therapy, is repetitive play with traumatic themes. Same topics are concretely and consistently repeated with no modification over time, which is why it's so important in therapy. If I'm doing Sandtray counseling with or therapy with the child, you know, I'm going to be asking them questions. Maybe I'll let them do their Sandtray first, but then implementing questions and trying to have problem solving and figuring out those emotions and identifying things with that child. And seeing like, okay, I see the little alligator is crying again. Like, let's just figure out, what does this little alligator need? Okay, maybe he wants to go swimming. Maybe he needs food, something like that, you know. And it's always very interesting seeing that process, especially with Sandtray. Again, for kids, sleep disturbances. If there's disturbances, especially younger kids, sleep, eating, play. This is like our main things we focus on. If those things are being changed, or there are changes or problematic things going on with that, those are things we want to hone in on, especially with the younger ages. So again, many different examples there for you on the screen. I also do apologize. I don't know if anyone can hear this, but the trash people are coming and collecting. So there's a truck outside. I do apologize if you can hear that noise. Okay, so school age, in terms of Erickson's stage is industry versus inferiority. So if you have industry, we have competence. If we have inferiority, then we have inertia. So this, again, inconsistency of like, okay, am I gonna be feeling like I can do well in my math test or my spelling test or wherever else I am, or am I feeling insecure and not really sure of myself and not really knowing where to navigate things emotionally and socially? So the general impact on this age is fear and guilt coupled with a wide range of emotion reactions due to intrusive images and thoughts, so trauma responses. From the child's perspective, they have the ability to judge the seriousness of a threat and think about protective actions and imagine actions they wish they could be taking. Usually don't see themselves as able to counter a serious danger directly. This is just something like that in terms of research, but I don't necessarily believe that's always true, even within the 5 to 12 range, because I've had kids who 9 to 10 years old who, again, they were pretty sure of what they would do with if they saw their abuser abusing the non-offending caregiver and planning like what they want to do in terms of revenge. And that was something we had to work on, because obviously we don't want the child getting into a situation where they're taking action to try to protect when in fact that they could cause more damage for themselves. May have feelings of failure, shame, or guilt because of inability to protect non-offending caregiver, or there's some type of semblance of not being able to protect themselves or a sibling, scared of speeding up their emotions and physical reactions. So even if it is a good feeling well, there's no good or bad feelings, but in terms of like, feeling excited or happy, though, if they're not necessarily emotionally regulated, even if they are feeling happy or excited about something, that can cause a lot of issues, because it's like that might also be associated with being nervous or anxious or, threats. So being mindful of that. Signs and symptoms of a child who might be impacted by DV in this age range is lack of capacity for emotional self-regulation. They move back and forth between shy or withdrawn behaviors and usually unusually aggressive behaviors. So maybe they're responding to something that might be considered like a positive thing, and then they might act out aggressively because they don't understand how to regulate themselves, and that's just how they deal with things. Lack of motivation to master their environment, because maybe there's learned helplessness and just like uncertainty and just like why bother if I have no control. Distorted perceptions of self, so maybe low self-esteem and things like that. Develop problems to divert caregivers from fighting. That is a huge one, especially just like with emotional health. There was also with all this, like if there is more trauma, people who have trauma or things like this in their life also have an increased risk of having asthma and things like and physical reactions, even though all of these are related to the brain. There's brain health, and our brain is associated with our body. It's all one thing. So maybe the child might, there was an example a doctor gave where there was a child who was constantly having asthma attacks, like really intense asthma attacks, and they weren't unsure what the trigger was or what was going on. And it turned out that when there was domestic violence in the home or an escalation of violence, the child started having asthma attacks, knowingly or not knowingly. So then the non-offending caregiver was able to bring that child to the hospital, and that actually decreased violence. So that was something interesting. Or I had a kid who, when mom and dad were in verbal arguments, they would start to build a Lego wall in between them. So just showing that. Parentification is a huge thing, again, from the 5 to 12 range, but I have also seen 3 to 4 year olds where that older child or one of the children might be taking care of their younger siblings. So maybe if a fight's happening, they're like, okay, let's go in the other room. I'm going to put on YouTube and we're going to be in here. We're going to go to the closet because that's our safe space. Or, caring to them, making sure they have their stuff for school or whatever it might be, just taking on those caretaker roles, which they're not responsible to do. And also at this age, children might start getting embarrassed of their family and understanding like, okay, something isn't right here. My family, other kids' families aren't like this. So what's going on with my family? An example I like to give is I had a client whose one of their parents was in a military branch, and there was also their neighbor whose parent was also in the same military branch, and an excuse that the offender would use is like, well, I was in the military, that's why I talk like this is why I yell like this, it's just the status quo. Meanwhile, this child, who I think she was starting when she was like 7 or 8, but her realization was like, well, my friend's dad doesn't act that way, so why? And he was in the same military branch, so it doesn't make sense that my parent is acting that way or using that as excuse because the other parent isn't doing that. So having that realization, that insight. Again, might have low self-esteem, depression, sleep problems, bunch of other things, school-related issues, increased risky behaviors, all of those different factors that could be impacting children. So for adolescents, we have identity versus confusion. So if we're like in it to win it, we know our identity, which, let's be honest, the teen adolescent years, which 13 to 20 range is within, is confusing enough. And there's a lot of trials and tribulations enough without domestic violence, but this is further being impacted if there is violence or trauma being sued. So for adolescents, we have identity, and we have our identity, we have fidelity, we like know who we are, we get it, we have, you know, we're feeling content with ourselves. Versus if we have confusion, then we're not going to necessarily maybe align with certain parts of ourselves or really understand different parts of ourselves, and still like deny parts of ourselves. So there's conflict. General impact, they might exhibit post-traumatic stress reactions similar to those in adults. And from their perspective of adolescents, they're able to actively judge and address dangers of their own, or so they think. They're more exposure to dangerous situations, maybe that they're exposing themselves to more high-risk dangerous situations, or maybe they're deciding at that age that they're going to intervene in interactions when there's DV going on. They have thoughts of revenge. Again, this can be seen in younger children as well. Make decisions about whether to and or how to intervene, and then use violence to count out that violence, which again is not good, because then we're just cause more trouble for ourselves and decreasing safety in some senses. And struggle over issues of irresponsibility, malevolence, and human accountability. So maybe not trusting other people and not seeing the good within the world. And again, signs and symptoms very related to post-traumatic stress. So maybe they're having intrusive thoughts, physical or emotional reactions to things. They're also seen to have lack capacity for emotional self-regulation, withdrawn, depressed, angry, combative reactions. Maybe they're self-disturbances, self-medicating with drugs or alcohol, sleep disturbances, eating disturbances, problems at school, maybe they're running away, or maybe they're to gain power and control within their life and becoming sexually promiscuous. So we're not going to get terribly into teen dating violence, but I figured it would be good to put, because we're talking about children and adolescents when it comes to DV and how they're being exposed. So I just wanted to have a nice little brief moment for teen dating violence. So teen dating violence is common and affects millions of teens in the US each year. It's similar to DV in adults. So there can be physical, sexual, psychological, emotional, and stalking. And technology plays a big role within teen dating violence. So noting that more than 40% of teens report being victims of cyber dating abuse. And as we know, that especially even now, if people are being apart because of COVID, there might be that increased interaction with social media. So maybe, you know, someone who's in a cyber dating abuse situation or in a teen dating violence situation, you know, maybe the abuser is taking control over, like, okay, who can you follow on social media? Who can follow you? Who's commenting on your stuff? Like constantly gaining access to their phone or their accounts, or, you know, putting GPSs, which can happen to adults too, putting those GPS trackers on their significant other so they can track where they're going and who they're with. Pretty sure on Snapchat, there's like part of the app is like you can see like on a map, like a Google map, where that person is, or like find your friend. Like these are all different tactics that an abuser might use as a teen or as an adult to track and to see what's going on with their victim. So these are just important things to note. Just like look the little stats here for you to observe if you're able to observe them. But just in meaning of time, we will continue. So what do children learn from witnessing domestic violence? So they learn that violence and threats get you what you want. It is a form of conflict resolution. So if my significant other is doing something I do not like, then I'm going to do X, Y, and Z until they submit to the thing that I want and not do the thing I don't like them doing. That kind of stuff. Violence is linked to an expression of intimacy and affection. And this is further, I can have a huge TED talk about this as it relates to how media also further reinforces this message. you know, it's like, okay, we have songs out there. It's like, well, you're toxic, but I'm toxic, and I'm messed up and you're messed up. But it's like, and our relationship is crazy and toxic, but it's like, but I love you. So like, let's be together and we're just gonna figure it out. And that's because we love each other. That's why we're gonna stay together, even though there's all this dysfunction in our relationship. Like, no, that's not a reason to stay together. Not good to be reinforcing these things. Even, you know, obviously like 50 Shades of Grey, just like this power and control dynamic, even though, you know, spoiler alert, as they're going on within their relationship, things seem to shift, but it's still, you know, a lot of control. You know, you have to wear this, you can't go there. Like, you know, he's literally stalking her and showing up to places, like all these different things. But because he's rich and handsome and all this other stuff, it's like, ooh, but I want that. No, these are unhealthy behaviors that are being reinforced. I even remember watching a commercial where they're showing on like, I think it was like Teen Mom or something like that, where the mom in the situation was like pushing her child's father against like a wall and holding him by the neck and like, you know, no, like essentially strangling him. And they're posting this on TV as if that was something that's like a normal reaction. And I never necessarily watched the show, so I don't know what the outcome of that situation was, but it's still something that is being shown. And it's like, oh, these people are in a relationship, maybe this is okay, and they're staying together for the baby. Thank you for coming to my TED Talk. So also victims are to blame for violence. So again, they're constantly hearing this message, well, if only so-and-so did this, then I wouldn't have had to do that. And you have to responsibility for your actions, not that it is the person's fault across the room or calling them obscene things. When people hurt others, they do not get in trouble. This is especially true if maybe say law enforcement isn't getting involved, or if law enforcement is getting involved and no one's getting arrested, or something goes to court and a person is acquitted of charges. It's like, okay, what are we learning here? Again, like maybe in reinforcing that learned helplessness, maybe not wanting to trust others. People who love you can also hurt you. Again, love and hurt. I mean, you know, when you're in love with someone, you're opening up vulnerabilities and things like that, which can increase the likelihood of being emotionally hurt. But love does not equal hurt. Toxicity does not equal love. Those are things, you know, that are not the same. And it's, you know, but as we know, you know, there are people who do love and do and truly love their abuser. And it's a big factor of why they stay. But, you know, trying to navigate that and understand that in a deeper level. Also, children are being learned that abusers are in charge and victims don't have the right to be treated with respect, because this is something that they're being shown on the daily, that it's like, okay, well, it doesn't matter. And that victimization is normal because they're living in an abnormal situation that is their normal. So they just think, oh, this is just what it is, and that's fine. So generational impact of domestic violence and trauma. This is something, again, I can have a whole training on just this when it comes to generational impacts. Epigenetics is like such a huge thing too, and just like understanding all the dynamics when it comes to families and how it impacts generations later on. So trauma that is transferred from the first generation of trauma survivors to the second and further generations. So that is what generational impact is. So it's affecting generations, or the affected generation do not need to witness or directly experience trauma to be impacted by it. So a great example of this is that research has been showing that the great-grandchildren of Holocaust survivors have increased or higher rates of anxiety than other populations, and they're showing that that is because of the trauma that their ancestors endured while being in the Holocaust. So that is just so again, like, here are these people not involved, directly impacted or directly involved, but they're still being impacted by something that happened generations ago. So I find that to be very interesting. And also Vanderkolk, he notes that the child's response to trauma is likely to mimic that of the parent. So if we have a parent who has a lot of anxiety, also has a lot of depression, that their child might also be having symptoms of anxiety and depression, because this is how they're seeing maybe a parent responding to things, so they might find or learn to respond in a similar way. Caregivers with histories of complex trauma may avoid experiencing their emotions, which make it difficult for them to respond appropriately to the children's emotional state, which in turn, if that child's not getting what they need emotionally or being taught, okay, when we're upset, we're not going to hit, we're not going to throw things, like this is how we have to manage our emotions in a more healthy way, then, you know, they might not be learning that, because their caregiver is not necessarily going to be able to fully involve themselves, because they're dealing with their own stressors and their own emotional dysregulation. So very interesting. So also here are little stats here. So just to like throw it out there to show like other impact is that 30 to 80% of boys who witness violence in the home abuse their partners as adults. Again, that doesn't necessarily mean that they fully are, but between 30 and 80 do. Interpersonal violence in the home is the strongest risk factor for transmitting violence across generations, and children raised in violent homes are 74% more likely to commit assault themselves. So I believe I might not necessarily mean like to a partner, but just in general. Important for like the you know, family services, if people are reaching out, it's like trying to help them to the best of our ability, because you know, they're reaching out because they want to break this cycle and doing the best that they can. And even if they are able to leave the relationship, you know, that's not where it's all over. Like there's still more work to be done, and that's okay. You know, Rome wasn't built in a day, and getting over trauma is not going to take just a one action type of thing. It's something we got to work on together. Oh, here we go. So now that we've talked about a lot of depressing things, and you're like, oh my goodness, I have no hope in the world, what is going on? Believe me, there is hope. Again, all children are responding to things differently. And one of which is there's so many different factors that help children to thrive. There's resiliency, which we did have to point this out as a huge, you know, resiliency as a protective factor in a way that we can help our children. So just a little quote that I love. I used to have another very wordy quote and I hated it. I finally found this one that defines resiliency, and I think it's beautiful. So resiliency is the quality that allows some people to be knocked down by life and come back at least as strong as before. Rather than letting difficulties or failure overcome them and drain their resolve, they find a way to rise from the ashes. So in life, there's always going to be ups and downs. There's always going to be something around the corner. And hopefully for the rest of 2020, we can hopefully not have more obstacles. And we hopefully can all push for our resiliency and fully overcome everything that's been happening this year. And, you know, if not, get back to a stronger state than we were before. But understanding that, and it's like things are, you know, going to happen in life, but how do we respond to them? How do we overcome them? How are we going to use our problem solving skills and our connectivity with our community to overcome these things? Because you might hear clients who are just like, oh, something always happens. But something always is going to happen. We got to figure out a way of overcoming those things. So children are changed by growing up with domestic violence home, but they are not forever damaged. And not all children are affected in the same way. And the sooner that we get involved with children who have been exposed to these or type of things, or just in trauma in general, or success they may have as an adult. So protective factors, so characteristics which enhance adaptation and resiliency. Social supports, connection to family and friends, at least one stable and committed relationship with a supportive parent, caregiver, or other adult. So that could be a teacher, it could be a coach, it could be a pastor, it could be their neighbor, their friend's parent, someone within their life that is consistent and stable and is there for them and show them like, hey, I'm here for you. So even though, you know, there might be the offender who is inconsistent and not supportive, even the non-offending caregiver can still be this person, even if they are experiencing their own trauma. Maybe they're trying to counteract that abuse by being stable and committed and trying to be consistent as possible. Another social support is affiliation with supportive religious or community faiths is a big factor, just community in general, which again, like for family services, we have so many different programs that are not only just going into the community, but also bringing the community to us to have that bond. Competent parenting, again, someone who is there, who is like being consistent, you know, trying to counteract that, like having that stability, predictability, and attachment. Again, 3 key words. If you're going to take anything away from this training, is those 3 words. If they have that with the competent parenting, that can further enhance the child's resiliency. If the child in general just has easy or engaging temperament, they kind of just like go with the flow or just like more low key, you know, and when something comes up, it's like, okay, I spilt my milk, but I'm gonna just go clean it up. If the glass broke, we're just gonna clean it up. We just gotta be careful, like, you know, where, you know, spilt milk happens, it's okay. If the child has higher cognitive abilities, so maybe there are, I was like to the client who was like seeing that difference between their parent versus their friend's parent, you know, we're able to question these things, to really look at this insightfully, asking questions and you know, being insightful. So that can build resiliency. Strong cultural identity, you know, knowing themselves, knowing where they come from, having that connection to something larger than themselves, but also liking that part of themselves and feeling a connection to that is a huge factor. Access to healthcare and stable housing and stable economic income. There should be a basic need. Those are huge factors because again, those are basic needs. Yes, healthcare, because we're trying to get these things. So if it's like, if I'm again showing consistency and stability, if something happens or if I get sick, I can go to the doctor and I'm going to be cared for. I don't have to worry about where I'm sleeping tonight, and those type of things. So ways that we can enhance or help to enhance resiliency of children, maybe the others or of our own, providing, again, consistency, predictability to counteract the abusive actions, creating that safety net, introducing a child to a positive role model for managing emotions and relationships. So that could be introducing to a great elementary school teacher who is modeling those things in the classroom, to bringing them to a therapist where they're doing those things, or having someone else in their life that's having those or managing or showing those skills and teaching those skills. Build connections to others for the child, giving child positive feedback to develop healthy self-esteem, so identifying their ability to succeed, identifying unique strengths they have, allowing identification of feelings. So something that I do if I have a child that I'm working with one-on-one, a little different now, but maybe we're in the child therapy room and the child can't open or having difficulty opening a Play-Doh cap, because let me tell you, it can be difficult to open a cap of Play-Doh. It's just like stuck. We're getting the Play-Doh out. You're just like, oh my God, I'm having a hard time with this, even as an adult. But I might have a child who's having a hard time opening something, and they say, I can't do it, I can't do it. And then the moment that they finally get the cap off, I'm like, oh, you thought, you know, look at you, you were able to do it. Like you kept saying you couldn't, but look at that, you were able to. Good for you. And then you just keep it moving, just like that moment of like, good, you know, praise, and just like showing like, okay, you had doubts, but you were able to overcome and do something. And it's something so minute, but it can have such a big impact. Those type of things. Teach a child how to communicate, show them when they say something, they will be heard and respected. Of course, it's not gonna, we have to attend to so many different things as an adult, but when a child is trying to talk to you about something, especially when they're trying to open up, just like really sitting with them and letting them speak and letting them feel their emotions and letting them do and process the things that they have to do and just being there for them. And not saying like, oh, you shouldn't feel this way or whatever. Like, you can't tell someone how to feel. Everyone's entitled to how they feel. They can't necessarily control what they feel, but how we respond, that is what's important. Just letting them that they're going to be okay. Teaching critical thinking skills, so challenging manipulations, power differentials, and gender stereotypes. So I'd like to give the example. I had a child who identifies as a male or a boy, and we were in session. I had the doll houses, and he really wanted to play with the doll houses, and saying that he wanted to. And so of course I understand that there was gender stereotypes, that he's he's a boy, so he's not supposed to play with dolls. But I played dumb, and I'm just like, well, what do you mean you can't play with them? And he's like, well, and I'm like, no, I don't know. Like, what is he? He's like, I'm a boy. And I'm so challenging that. And eventually he did start playing with the dolls in the dollhouse and have grand old time. But just showing that it's okay if you wanted to go do that. Like, I'm not here to judge you for something that you wanted to that's not harming anyone else. Like, go do your thing. Go play with the toys you want to play with. If you want to be an engineer, go be an engineer. If you want to be a scientist, go be a scientist. If you want to go cut hair, like whatever. So just showing those things and showing that, again, especially for toxic masculinity, like counteracting those things. It's okay for everyone to cry. It's okay for everyone to feel emotions and do things. It's okay to feel fragile or feel strong, and just counteracting all of those type of things. Mobilizing source of faith, hope, and culture traditions. Again, if we have identity for ourselves and those connections to a community, we can help to build resiliency, providing opportunities to strengthen adaptive skills and self-regulatory capacities, which is, why I love to do different deep breathing exercises, progressive muscle relaxation, different scripts like that with kids, just like understanding emotions and what we do with our emotions when we're feeling a certain way, building those coping skills, building those self-care skills, all of those type of things. Building a sense of self-efficacy and perceived control. So, most kids don't have control over a lot of different things because they're being managed by adults, but just giving them some sense. So it's like, if we're giving a kid like choices for dinner, I'm not saying asking a kid, what do you want for dinner? Do not go down that trap of a question. It's like, oh, what kind of ice cream? I want this, I want whatever it is. But maybe offering them, okay, well, do you want broccoli or do you want green beans tonight for your vegetable? And I'll make that. So it's like, okay, we have a choice in like something like that. Again, giving healthy choices and then letting them pick from said healthy choices. Very good. Or even if I'm in a session with a kid, okay, well, like, maybe I have something planned for us, but for the first 15 minutes, relax, 15 minutes, depending on the age of the child, okay, like that's our free play time, and you get to choose what you want to play with, or I'm going to follow their directive and insert whatever the goal was for therapy that day, but then what they choose to do. And again, facilitating support adult-child relationships, so building that protective factors, protective caregivers within their life. So something I do a lot with folks is safety planning with children and safety planning with parents when it comes to DV. So safety planning is maybe again, this is something where it's not the end all be all. We have to really individualize safety planning when it comes to domestic violence, because some things might work with one person and they might not work for another. So we really got to look into, you know, all different aspects of like what we can do. So maybe we want to start a journal. That could be a productive first start. Again, if that's safe to do. It's not safe to do, we don't want to do that. We don't want to have maybe a journal where the abuser can find it or have easy access to it. So just keeping those things in mind. So assessing protective parents' hopes and fears. So you want to, when we're working with a child, we want to work with the non-offending caregiver as well. Try not to put parent in these slides because, you know, that's not the only person who's taking care of the child. But whoever the protective caregiver is like, what are their hopes and fears related to the child and the abuse? Assessing the child's hopes and fears when it relates to the abuse. Assessing strategies the child has used in the past to either avoid, divert, minimize, or stop abusers, triggers, or violence. How to assess competence of the child to execute a plan. So I say, if we have a 3-year-old, we're not gonna be like, okay, let's call 911 when they don't have a phone or access to a phone or can't reach a phone. So really understanding, is this child able to execute a safety plan, or is this something that's too overwhelming? Maybe it be like, you know, if something happens, maybe you go to your room, or if you know, something happens, go to school the next day, who could you tell? And kind of assessing all of those different things. And kind of, again, like noticing what they've been using already as protective factors and ways maybe we can amplify them or understand them better to help to mitigate the abuse. So safety planning around visitation, because again, that's going to happen, that parents have rights to their children regardless of the situation, and it takes a lot for folks not to have visitation between an offender and a non-offending caregiver. So yeah, factor that in. So if possible, having a court order regarding visitation can be important, but it's also important to sit with our folks and see, okay, what are the pros and cons, so that you can make the most informed decision on if having a court-ordered visitation, like contract type of thing, is that the most safest thing for you? Is that the best for you and your family at this time? Or is that going to increase conflict, and now the abuser is going to use the system against you and use court as a form of abuse and can continue to you know, to abuse you through the court system? So we got to look at the pros and cons, and always in giving the power back to the victim so they can make decisions. Consider a possible visitation contract. Consider that a parent cannot be drinking during visits. That's always important. Remove weapons from the home, not to question the child about the other parent or talk about the other parent in front of that child. That is something that happens so frequently, where it's just like kids just like being questioned and being used as a spy and not knowing it. Can take objects brought to visit home again. So if they brought certain clothes with them to the visit, they can bring those clothes back, and hopefully they're not going to be damaged, because that is something that happens as well, or things just go missing. The parent will not come into the bathroom or the bedroom, or respect the child's privacy, especially if that's age appropriate. Allowing child to call the other parent whenever they want. Again, there's stipulations around this, especially if there's a court order in place. Sometimes children are not able to call their parent whenever they want, or maybe can only call once or can't call at all. But like trying to work around those things and not forcing the child to eat certain things. So these are things that hopefully someone agrees to. But again, when there's domestic violence, these things might not be agreed to, and the child's rights and wants may not be respected. So trying to figure that out. Anticipate the abuser will try to implement manipulation tactics around the visit. So it's like, okay, well, maybe they're not showing up on time and making the other parent wait, or maybe where the drop-off point is, they're controlling that. So it's like, no, you have to come the hour here, and bring the kid and drive an hour back, and instead of meeting halfway, whatever it might be. Or maybe they're showing up late to the drop off, just like a lot of inconsiderate things. So trying to anticipate these things and plan for them. Identifying safety facilitators in the context of the visitation, so people, places, and things that might enhance the child's safety. So maybe we're at a point where we're having visitation at the visitation center and those things are being documented, or maybe we're using a grandparent to do the visitation or something like that, or somewhere where the child feels comfortable. Going to a restaurant, the child feels comfortable, or doing child-related things instead of whatever else the abuser has planned. So other safety planning with children, ways that we can help them is building coping mechanisms while they're away from their non-offending caregiver. So maybe they want to bring their favorite movie or headphones or a comfort toy or something safe to remind them of their protective parent. And these things might not always be safe, but again, assessing those situations where maybe they want a picture of their family to feel comfort. Warning signs, or teaching the child, if appropriate, warning signs of intoxication or mental health issues, especially if threats of suicide have been present in their life before, and what to do. So again, assessing their competence of like, okay, can you call 911? Are you able to use your your fancy watch to call somebody, or whatever it might be, or send a text message. And teaching kids too that do have phones to utilize the 911 texting ability, if that is applicable for them. Abduction prevention, like warning signs, knowing their name and address, how to scream, how to pass notes. A child who's very good at this when it came to like meeting their abuser at this specific location, which was a public place, and they were not feeling comfortable, and was able to pass a note to one of the workers there, and they were able to call the police because the child was feeling threatened and scared due to things that the abuser was saying to them, and about their unoffended caregiver. And building critical thinking skills, again, like assessing logic of abusive statements such as mom hates you, or things where it's like, well, your mom doesn't actually love you, and your mom does this because, she hates me, or whatever it might be. So really assessing those things and tricky questions or tricky statements that the child might be confused about. So other ways to help children is, first and foremost, letting them know the violence is not their fault. Again, younger children are going to think that it's their fault. I play lots of different games where we are assessing different situations where it's like, okay, well, this, here was an incident, this happened, whose fault was it? And, noting different perspectives of the violence situation. But letting them know the violence is not their fault. The violence is only the fault of the person who is perpetrating. Helping children identify their feelings, because again, sometimes they don't know how to do that, or they might be feeling a lot of different feelings. So we might go over big feelings, small feelings, and things like that. And listening to what a child has to say, even if they have a whole different perspective. It's again just like spending the time holding that space for that child. And creating a safety environment for the child and establishing routines, again, predictability, consistency. This is why it's so important when it comes to discipline and just like nighttime routines, eating routines, things like that, to have those things that are expected, especially when it comes to like discipline, where it's like, okay, if you misbehave, then the outcome of that misbehaving is going to be, you're going to have your phone taken away. Like having those things, expectations, just so that they have that consistency. And when kids are older too, maybe even involving them in the disciplinary things. Like, okay, well, if you break curfew, what's going to be your punishment? And it's like, okay, well, I'm not going to have car for a night, or whatever the situation, or maybe I'm not going to be able to use TikTok or something for a week, whatever it is, so that they're involved and taking responsibility for things that they're not supposed to be doing. recognize and applaud their strengths. Love that. And first and foremost, being a role model. And last but not least, supporting non-offending parents. And because of course we have our children, but we've got to work with the parents as well. So children, because their relationship with their non-offending caregiver might have been undermined, that child might be angry at the non-offending caregiver for either bending to the offender's will or not leaving sooner or whatever the situation is. Or they might be angry at both parents. They're angry at the offender for the abuse they're enduring and all that kind of stuff. So we want to repair the relationship between the non-offending parent and the child and or the family unit and siblings. Again, because two siblings, there might be different roles that they're taking. There might be the one child who's identified as the scapegoat, who's getting the brunt of the abuse, or the problem child versus maybe another child who's the one who's being parentified and taking care of the children and reestablishing boundaries when it comes around that. And not just supporting the individual, but how the trauma of the abuse is impacting them. So the non-offending caregiver, so their own abuse, how is that impacting them? How is it impacting their parenting? Maybe we want to work on that. Maybe that parent wants to go take parenting courses to understand different parenting techniques and skills and things like that. Just how to support them so they can support their child. And often both the child and the non-offending parent should be in counseling, not just the child. So it's not like, here's my kid, fix them when it comes to children and the problems or problematic behaviors that they have or the emotions that they're having. It's not just going to change with them, it's going to have to change with the family unit too. So again, the environment needs to change with the child's experience change and start to thrive. So with all of that information, that is the end of the conversation for today as it relates to this training. So if you do have follow-up questions, I do encourage you to reach out. I don't mind. But I'm just going to go look at the chat now and give some time if folks have, I know we're at 1:30 now, but if folks do have any follow-up questions at this time, feel free to ask. Thanks for enduring me throwing so much information at you to process in an afternoon as well. You're welcome, Beckett. Miss you guys. Okay, I'm just gonna sit here for a moment, see if anyone has any questions. So feel free to jump off if you don't. And again, feel free to email me if need be. And you're all welcome. I hope this was helpful for everyone. Okay, so it doesn't really look like others have questions. So thank you guys again. I hope this was fruitful for you and feel free to reach out. I am an open door, open email. Thank you. Hope you have all a great day.